Okay, so we are now recording this. All right, so welcome everybody. Welcome to my class, and welcome to the PMD 101 students that are in attendance today. Our guest physician speaker is Dr. Emily Walford. She's a Miami alumna. She's did her Bachelor of Arts, what was in zoology. We didn't have a biology program at that point. We called it zoology. So she did it in zoology. And then she went to Northwestern University School of Medicine, where she earned her MD, and then has now been hanging out at Indiana University School of Medicine. She specializes in pediatric endocrinology, and she is associate dean or assistant, some dean position, student affairs. I don't remember, associate, assistant. It's still, you're looking out for people, and that's what's really cool. Anyway, she's been a member of the Mallory Wilson Center Board of Directors. She comes back for meetings. She does work in terms of preceptorships and shadowing when such a thing is allowed. And we're really glad to have her here talking in our class today. So she's set to talk about some of the things that, the issues and things that she thinks are important to share. And so Dr. Walford, I'm going to turn this over to you now.
All righty, thank you. So hi everybody. Thanks for joining me on this. I don't know what it's like there in Oxford, but here in Indianapolis, it's actually a crisp, sunny day. So thanks for joining us. Please send chats, and Dr. Carlin can interrupt me. And then there are some times where I'm going to ask you guys to unmute and shout out some answers, so it's interactive. But in thinking about this talk, Dr. Carlin, there were a number of different topics that I thought about talking about. So hopefully this is a few things all put together. So the plan will be that hopefully I can help you guys understand medical training a little bit better, because I work with a lot of students. In particular, I've been struck by our first year students when they come in. Some have a really good understanding of what medical training, medical school, non-residency, fellowship, and beyond are like, and others maybe don't have anyone in their family who's in medicine and don't have the same understanding. So I thought I'd go through that a little bit with you guys. And then think about different challenges in terms of having a career, a lifelong career as a physician, and then how to start thinking about maintaining the joy that you find in your life and in your career now. So you're ready for the long haul. And so we're gonna have fun, and I want you guys to ask questions, okay? All right. And those of you who have camera on, I see you're ready. Cameron gave up. All right, let's do this. Okay, so you already heard my story a little bit. I am a proud Miami grad. I won't tell you what year. But then I went to Northwestern for medical school, and I stayed there for my residency as well in pediatrics. So I did a 3-year pediatric residency, and then I actually stayed an extra year as a chief resident. So I was there for actually 8 years, 4 years of med school, 4 years of residency, and then moved to Indianapolis to do my fellowship training in pediatric endocrinology, and ended up staying on as faculty, and now have been here for a number of years and have had a number of different roles here at the school, including being associate residency director. I actually was an assistant dean in faculty affairs and professional development for 7 years, and then moved into student affairs, which I absolutely love. So what does that mean in terms of medical school? There we go. So I wanted to tell you guys a little bit about our structure here at IU, not because I'm trying to sell you on IU, but just so that you have a little bit better understanding of what things will be like should you choose to go to medical school. So I'm just going to quickly run you through the 4 years of medical school, and then explain a little bit about residency training, and then I'll pause maybe and see if you guys have questions. And I'm sure you've heard a little bit about this, but already I'm going to hope. Medical school is exciting. It's hard. It's supposed to be hard, right? Being a doctor, being a physician, having patients' lives in your care is an important job. So it should be hard. You have a lot to learn and learn how to do. But the first, depending on where you go to medical school, either the first year and a half, or maybe even the first 2 years, which is not so much the case anymore. That's the more traditional model, to have a full 2 years of basic science or classroom science or foundational science, whatever people call it, is a little very traditional. That's what I had, the 2-and-2 model. That's less so now. We do about 18 months at IU, and other places it's the same of foundational sciences. So in your first block, you can see here, you do human structure, which is our fancy name for anatomy, which also has like embryology and histology all mixed in. We do molecules to cells to tissues, which has a lot of biochemistry in there. And then the yellow is the best part, the foundations of clinical practice. That's where you learn how to be a doctor. You start learning about taking a history, learning how to do a physical exam, how to talk to patients, how to work in a clinic or a hospital. And that small group work, as well as pre-COVID, we had students who came and shadow physicians in clinic or in the hospital, and I'll tell you about that a little bit more in a minute because I have some pictures of my longitudinal preceptor students from their first year, which is super fun. They loved coming to clinic and seeing patients and then thinking about how that fit in with what they were learning in class. So that's first semester. And then second semester, fundamentals of health and disease and host defense. So that's a lot of microbiology, immunology, learning pharmacology, drugs to, antibiotics, things like that. And then neuroscience and behavior after spring break is really the first time we do block courses in terms of organ system based. And then that moves our students into their second year. So they have vacation over the summer. Most medical schools still have that, but not all. A lot of our students do research, or they travel, or they do shadowing experiences. There's some really cool international programs. Again, hoping we're all going to get back to close to the way things were before COVID. But then they move into the organ system blocks, which has a lot more clinical application, which they love. And then their second year of foundations of clinical practice, again, learning how to be a doctor, work with patients, again, perfect your history and physical exam, taking skills. And then we end up with a big block, endocrine, the best one, of course, reproduction, musculoskeletal dermatology, and then USMLE step 1. Raise your hand if you've heard of that, step 1, or exams, board exams. Yes, isn't that sad? You guys already know about this. It's a huge stressor for our students, but we have pass rates above the national average, and over 90% of students pass their first time nationally. So you don't need to worry about that yet, you guys. Okay, and then the fun really starts, because after that third year, but that actually starts in the spring of your second year in medical school now, is you start rotating in the hospitals and the clinics, and you do big blocks of like internal medicine and surgery and pediatrics, and a little bit less time and things like psychiatry, anesthesia, family medicine. So the basics. So those are your third year clerkships, which are the basics. And then fourth year, we have some required components. One, that you do critical care of some sort. Like me, I went into pediatrics. I might have done neonatology or the NICU. Or if you're going to do surgery, you might do the surgical ICU, so you get to pick, but it helps get you ready for residency. You do your sub internship. That's also called an acting internship, where you get to be a full-fledged member of the team, and it's like you're acting as an intern even though you're still a medical student. And then you do a block of emergency medicine, and the rest is electives, which is super fun and cool, and you get to do things that you're interested in, and try out different specialties. Like maybe you want to be a dermatologist, you think, so you do dermatology, and then you don't like it, and so a few months later, like, well, maybe I'll try neurosurgery. So you do a month of neurosurgery and see if you like that. So fourth year is super fun, and you get a lot of vacation time, as well as this pink block, and that's interviewing for residency, which is then the next step of your medical training. And this is the best day of medical school right here. Who knows what that is? What I'm showing pictures of. Who can unmute? What we call that?
It's match day.
Yeah, it's match day. Looks like Sophia knew that one. The absolute most fun day of medical school. So this picture here, can you see my pointer when I'm doing that? Okay, this is last year, sadly, Zoom match day. But otherwise, it's like, look at all these happy faces. Everybody opens their letter at the same time. We have a huge party, and everybody at the strike of noon gets to open up their letter and see like these happy people where they match for their residency. And then we have people come up and then say it on the speaker and announce it, and we make little signs so that everybody can see where they matched. And then you can take pictures with your loved one to put on your Instagram story. So it's super fun. And so then last year, here I am with my boss, Dr. Allen, and students. And there's our class president, Zain Abadali, who's now a urology resident, who gave some words. And then everybody opened their envelopes remotely, and then they sent us in the Zoom where they were going, and we made signs. And there's one of my assistant deans being excited. So we tried to make it exciting. It wasn't quite as exciting, but it was exciting for the students to find out where they have to go. So that's my favorite day of the entire year, match day. Okay, I'm now going to quickly go through residency, and then I'm happy to answer any questions before we move on to the next part. So this is a huge amount of joy. So when I'm feeling a little down, I try to remember match day and all the excitement, and I get the students to think about match day. Okay, so residency, depending on what you go into, will be anywhere between 3 and 6 years. So family medicine, pediatrics, internal medicine are 3 years. OB/GYN is 4 years. Surgery is 5 years. Orthopedic surgery is, what is 6 years? Neurosurgery is 6 years, okay? They're broken down in different ways, and I have a couple examples in a minute. Fellowship, so that's what I did 3 years of a pediatric residency, but then, like I said, stayed on an extra year to be a chief resident, which is kind of like a junior faculty member. But then I came to IU to do a fellowship because I wanted to be a subspecialist in pediatric endocrinology. And that was 3 years. It included actually a very large research component. You don't have to do bench research. You can do clinical research. I did a little bit of both. But every program is different, and it depends on what you're interested in. And you can even do now like medical education research or quality improvement research, which is very cool. And it's 3 years to be board certified in pediatric as a pediatric subspecialist. There are some internal medicine specialists that you only have to do 2 years to be board certified. And then there are some fellowships that are a year, like for example, you can do a 1-year fellowship in like informatics or something, but you don't necessarily get official board certification in that in a 1-year fellowship. Or like orthopedics, you can do, or a good example actually is like radiology. You can do a 1-year fellowship in body imaging, which I think to myself, well, doesn't all of radiology image the body? I don't understand that. But it's really just learning how to do like CTs and MRIs of the thoracic cavity. So I don't know why they don't call it that. But anyhow, and then following that, you either after residency, you can go straight into practice, fellowship, you can go straight into practice, private practice, or if you decide to stay on at a medical school and become faculty, it's the similar structure like in all of higher education. You start as either an instructor or an assistant professor, and then you move up the ranks to associate and then full professor, having to do research, service, teaching. But you don't need to worry about that now. And hopefully Dr. Carlin doesn't have to worry about that kind of stuff either anymore.
I do it all.
So here are some examples, again, to just help you guys understand the timeline, because I think it's important to know what you're getting yourself into. So again, here's my example, which I already told you about. I did it, it's 6 years, but I did an extra year. A radiologist, you do a 1-year transitional internship, meaning that you still take care of patients in like the hospital wards, the clinic, the emergency room. You might do a little operating room time. And then you do 4 years just of radiology, so hanging out in the radiology suite. And you might do a 1-year fellowship, like I told you about. Plastic surgery, then there are a couple different routes. So you can either do general surgery for 5 years and then do a 2-year fellowship in plastics. Or now a number of surgical subspecialties have what are called integrated residencies, where it's integrated. You do some general surgery, but then you do your subspecialty training at the same time. So you could do a 6-year integrated plastic surgery residency. These are super competitive, these types of things. They have these as well for thoracic surgery. And a few other examples. You don't, again, need to worry about this now, but I just want to show you that there are different routes. And it is a lot of training, but what I tell students who start to worry about how long training is, I say, you know what, if you're lucky, life is long. And so a year or two extra to get to be where you want to be and doing what you want to be doing is totally worth it. And you don't even remember that it took you an extra year or two because you get to do what your passion is. And again, if you're lucky and have a long life. So my husband, who does emergency medicine, which actually you can do either a 3-year or a 4-year residency in emergency medicine, his friends in emergency medicine, first of all, could never understand how anyone wanted to do pediatric endocrinology. But then they used to tease me and say, really, you did 7 years of training? You could be like a neurosurgeon by now. And I said, wouldn't want to be a neurosurgeon. I want to be a pediatric endocrinologist. So 7 years was well worth it for me. All right, so now is when I'm going to pause and ask if you guys have any questions about that. And I don't know if any came up in the chat, Dr. Carlin, or if people just want to unmute. I'm comfortable with either one.
Yeah, nothing in the chat right now. So
maybe you've heard this all before.
I have a question.
Okay.
So what did you, I had like not heard of chief residencies until like maybe earlier this year. Why did you, I guess, so you described it as like being like junior faculty, but like why did you decide to stay and take a chief residency year?
Sure, that's a great question. So some programs it's built in. So for example, my husband did emergency medicine, it was 4 years, and then they picked kind of who they thought would be the best chief residents, and it's an honor. And you have some extra administrative responsibilities, but he didn't do an extra year, he just did extra work during his last year. But in PEDS at a big program, Northwestern's a big program, they actually have 2 chief residents and you take extra. So 1, it's an honor to be asked to do that. 2, you learn a ton. So I learned a lot about academic medicine by serving in that role, being an administrator, being a leader. So I got to, develop my leadership skills. I got to do a lot of teaching. The chief residents run one of the teaching services. They run morning report, which is a time when the residents come in and talk about the patients they admitted overnight, and you just on the fly do a lot of teaching, and so you have to be well prepared. And you give lectures. We used to write up little cases, and then we also had the quite a bit of administrative responsibility. So it's like you get a taste of what it's like to be an administrator, a leader in academic medicine. You get to, and it's also an honor to be asked to do that. And it's kind of just an extra, not just, but another year of learning and training. So some people say, I don't want to do it. I don't want to stay in academic medicine, or I want to go straight to fellowship. I don't want to take another year. So there are different reasons to do it, but I hope that helped.
okay, I have a question in the chat from Grace. It says, what do you think medical students can do to become more competitive for residency positions?
Oh, that's a great question. So that person I showed in the picture, Dr. Rusk, I have an assistant dean who works for me in my office that's her whole job is to helping our students get ready for residency. So to be competitive, so the first and foremost thing is do well in your academics. So we're pass-fail for the first, for our foundational sciences, but you don't just want to skim by, because then you have to take step 1. Now step 1 is going to be go pass fail starting next year. So you won't have a score, but then the next one is step 2 CK, step 2 clinical skills. So that's when you integrate all of your knowledge and then you make the questions are about patient care. So if you, study hard, work hard, then you'll do well on step 2 CK and have a good score. And you also will get good. So our clerkships our 3rd year are graded. I mean, the grades are honors, high pass, pass, and fail. Okay, you don't want to fail. But, so it's 3 different grades that you can get. So if you study hard and learn a lot and work hard, you can get good grades. That's the most important thing by far. But in addition to that, getting involved in research, if that's of interest to you. Again, it can be clinical, basic science. We have students who do medical education. I have a student who did a little medical education research project with me last year that he had a poster presentation at a meeting about. And community service, we have students that are extremely involved in community service. And that, again, develops leadership skills, develops communication, it demonstrates your care and advocacy. So you really have to figure out what your passion is, and then put some time and energy into that. I hope that helps. And it also depends a little bit with what you want to do. If you want to do something like orthopedic surgery, which is extremely competitive, you need to do orthopedic surgery research. If you want to do, pediatrics, and you want to be able to go to a really strong program, you need to display some significant, kind of interesting work that you do, but it doesn't have to be research. It could be that you develop this super cool advocacy project. Or in fact, one of our top students going into pediatrics this year, she was the founder of our wellness coalition, which has done amazing stuff. And that is going to look fabulous on her resume.
Okay, next chat question from Anna. Could you explain a bit more about how matching works for residency and what goes into that?
Oh, all right. Yes. So matching is kind of like, I'm going to use the analogy of like sorority rush. So you go around, and they use the same computer algorithm program, actually. So you apply to different residencies. They invite you to come for interviews. You go and interview, and you interview them, and they interview you. And then in the end, you submit your rank list, what your top choices are. And then they submit their list for who they want. And this, Nobel Prize winning, which is true, algorithm gets run, and you get matched to a program. I don't know if that helped or not. I'm assuming some of you know how these computer programs work. But it is, you have to get invited for interviews. So students apply depending on how competitive they are and what they're going into and what they're, say they only want to live on the East Coast. It depends on how many programs you apply to and how many interviews you go on. And then you decide. It always defaults to the applicant's preference. So even if other programs ranked you in their very top, but you wanted to go to, Miami of Ohio, then, and they ranked you in the top, then you'll get Miami.
Okay, let me follow up. What if you don't match? Does that happen?
Yeah, so I said match day is my favorite day of the year. It's always on a Friday. The Monday before that is my least favorite day of the year, because that's when we find out which students didn't match. And that is the most awful day of the entire year for me and my students, most importantly, the students.
Oh, yeah.
And so then they go into something called SOAP, which is called Supplemental Offer Application Process. So there are always open positions around the country in residency. It might not be what you want to do. So some years there are not any open positions. Again, I'm just going to use ortho since there were no open ortho positions in the country last year. So if you didn't match into ortho, you have to pick, either take an extra year and maybe do research and then apply the following year, or you have to go into something else. So you might do general surgery instead.
Okay. So it's not a dead end then?
It's not a complete dead end. It's extremely disappointing, but it's definitely not a dead end. And I would say
it's a sharp turn in some other direction, yes.
Right.
All right. Okay.
All right. So if it's okay, in the interest of time, only because I have plenty of time, but I know what it's like to have a class run over, I think we'll keep going, and then I'm happy to answer questions at the end. Okay. So I am going to ask you guys now to stay tuned in, and we're going to move into a different part of and so I want to ask you, what do you guys think might be some of the challenges of being a physician and practicing medicine? And I have a little picture up at the top that might prompt you in case no one wants to think of anything, or is shy, I should say. Ooh, I saw Cameron now.
Seeing your friends who are business majors go and make 6 figures first year out of college.
Oh, good Lord, yes, absolutely. I saw that. Well, I lived in Chicago and saw all these other people around me making a lot of money, and I was still a student. So that is one of the things we'll talk about: delayed gratification.
Okay, a couple of things coming up in chat. Burnout and time management and maintaining a happy family and work-life balance. And all your friends are working already. You are still in school. and debt, working 60 to 80 hours a week, and mental health.
Ooh, those are all good, all important ones that we're gonna.
And being limited by a medical company that makes decisions for you.
Oh, I think someone meant insurance company, but yeah. Yeah.
All right, that was what I had on the chat.
Okay, anyone want to add anything else? Okay, so I think you guys hit a lot of the ones that I had down. So I kind of think of these as like internal challenges, internal to yourself, and then external challenges. So like, and I can only see his name, and so that's why I'm calling on poor Cameron. Cameron brought up this idea of your friends working and making money. That is absolutely true. And that's why I had that little picture. This is the tortoise and the hare situation. Okay, you got to be in it for the long haul, the delayed gratification, because yeah, you're still going to be a student for a number of years. But again, you're doing something that you are excited about. Long hours, it's very demanding. You know, being a medical student's tough, being a resident's tougher, being the one who makes decisions and has to live with those decisions is also tough, but also exciting. Stress, I'm putting her self-doubt. You know, most people that go into medicine are pretty hard on themselves, and so end up doubting themselves, having something I call the imposter phenomenon. There's the debt, and then poor work life, home life integration. So we'll talk a little bit about that, but those are challenges. And then external is, you know, the education structure is pretty rigid. I just showed you our schedule. It's not like you can pick to say, well, you know what, I think I want to slow it down, go over 5 or 6 years. That's not really an option. Or I want to take different classes my first 2 years. No, not really an option. So it can be pretty rigid. EMR stands for the electronic medical record system. That I'm sure you've all heard about that. New care delivery models can be challenging. You know, PAs, NPs, physician extenders, that can be a challenge. Productivity expectations from for who you're working for, like certain number of patients you need to see an hour, something like that. And then administrative burdens. That actually, those things are things, my grandfathers were both physicians. Neither of my parents were, but both my grandfathers were. And I would say that the only one that they had to deal with was the rigid educational structure. The rest they didn't have to deal with. So these are all relatively new things. So we'll talk about some of those, but I have to say, I am very hopeful about you guys and your generation going into medicine, and here's why. You guys grew up with computers, okay? The electronic medical record to you guys, first of all, it's going to be way better by the time you get into medicine, practicing physicians. Second of all, you know workarounds, that is not going to be overwhelming to you at all. It's to people who are my age and above that it can be exceedingly frustrating. Okay, so the EMR, I don't think you guys are really going to be bothered by that. Quite honestly, our residents are not that bothered. They show me all the time how to do things and give me tips. And then the care delivery, productivity, administrative burdens, you know, that is getting better all the time, but I'm going to put a plea to you guys out at the end about how that's something to think about and how you can prepare yourself for that. Okay, but some of this stuff is going to be better, and I think you guys are well positioned to it not bother you. I think it's people my generation that these are all new things that have come upon us, and they're always going to be new things, but I think there's a lot of work going on right now to fix a lot of this stuff. Okay, so so we talked about the challenges, but what about the rewards? So my goodness, we would never want to do anything if there wasn't any reward or happiness to it. So what are some of the great things about being a physician providing medical care?
They're typing.
They like you reading them, Dr. Carlin.
I know.
Which is fine.
Okay. All right, guys, what rewards are you anticipating? Okay, you get to improve patients' quality of life. You have some unique doctor-patient relationships. You are constantly learning. You're helping people. You're seeing tangible improvements in patients' life. You're being a lifelong learner. These are all good things.
Love it.
All right. Possibly
right.
curing diseases. Oh, there's more. We've got a few more coming in now. Being there to motivate minorities, being able to make people's lives better. You're able to meet people and build lasting relationships, and you're constantly interacting with new people.
Love it. Wow, you guys are on it. You don't need me to talk about these things. So here's what I would say, and I think you guys hit on a lot of these, the internal and the external. Again, internal satisfaction of helping others. Okay, you make a huge impact you can in people's lives, and that is exceptionally rewarding. And you make meaningful relationships. Someone mentioned that also. It's not, to me, honestly, I love medicine, and that goes in the intellectual stimulation I still love, but some of what I do is not, to me now, having done it for many years, it's not as kind of intellectually stimulating. So what I enjoy more is the relationships that I form with patients. They're still cool things, don't get me wrong, and I love learning new things all the time, but those, without a doubt, those are amazing. There are also technical challenges. So for example, if you become want to do something where you do a lot of procedures, that's fun to do procedures, and then always want to get better at that or invent new procedures. Autonomy, physicians really do have a lot of autonomy. Okay, as a professional person, that's one of the things, that's why physicians are tough to deal with. It's because we don't like people telling us what to do as professionals. So that's a great thing. A lot of people don't have a lot of autonomy in their work. Compensation, doctors are paid well. Okay, you're not going to go into medicine to get rich anymore like you used to, but you are paid well. You can live well and live comfortably. But if you're going into medicine for the money only, then I think you definitely should listen to what someone else said and get your MBA and make 6 figures right out of college. That's probably the better route to go. Doctors do still have a lot of respect within your community, which is nice. It also is a burden and a pressure, but it is a job that's still highly respected. External, you get to improve the health of individuals and communities. Like you said, you can cure disease and make your communities better. Educate the next generation. Someone said you can be a role model for minorities. Absolutely. That's actually one of the things I love about my job is that we have one of the highest % of our students, of medical students in the country in underrepresented medicine are here at IU, and I absolutely love working with students from underrepresented communities. And then you have a lot of opportunities for leadership too, which can be fun and rewarding in its own way. So there you go. You guys hit a lot of those. So I think what I'm going to tell you next is some of the things that satisfy me about medicine, tell you a little bit about being a pediatric endocrinologist as we transition to a new phase, so you guys can learn about that. Oops. So that, I'm going to move that. That's weird. It was supposed to be animated and my little guy was supposed to show up. So here are my 2 favorite organs. They both begin with P. The anterior pituitary and the pancreas. Okay, so I take care of kids who have diabetes. So I love the pancreas. And then I also take care of a lot of kids who have hypopituitarism, and I did research on that as a fellow and as a junior faculty member. So I love the pituitary and fascinated by pituitary development, and I love taking care of kids with pituitary problems because the beauty is we can give them all the hormones that their own pituitary isn't making and make them healthy and whole again. So I love being able to treat things with hormone replacement and, really, you're not curing them because they still have their disease, but you're making them feel healthy and whole again. So now this little guy, so I'm going to tell you about this guy as an example of why medicine is so fun. So this little guy came to see me. Okay, have a look at him and type in the chat, and Dr. Carlin will tell us, what's your guess of how old this guy is? Okay, so while you're typing that in, I'm going to tell you that this guy came to see me and he was 4 years old. Okay, he doesn't look 4. He was the size of a 2-year-old. His parents told me he had not grown in 18 months, since he was 18 months old, excuse me. He had never had a haircut. He was 4. He'd never had a haircut. And he had been sent to me by a pediatric gastroenterologist who was still a super smart pediatrician, because he went to a gastroenterologist because he had terrible problems with constipation and abdominal distension. And the pediatric gastroenterologist made the diagnosis and sent him to me to take care of him, but I'll tell you what else is about him and then I'll say what happened. So he hadn't grown since he was 18 months old. He was the size of a two-year-old. He never had a haircut. His parents told me every time they got in the car, he fell asleep. He slept all the time. He had developmental delay, sadly. If you look at him, I would describe him as having kind of coarse facial features. That's a medical, kind of medical jargon. He had an umbilical hernia. Okay, that's his belly button pooching out there. He had terrible constipation. He had very dry skin. I already told you his hair didn't grow. And he was cute, but he looked a little bit not quite like you'd expect. So his diagnosis is that he had profound hypothyroidism, profound. And in other countries, if this was worse, he would be called a cretin, which we almost never, ever, ever see in the United States anymore. So this is what my little guy looked like after, I kid you not, 4 months on thyroid hormone replacement. 4 months. And look at how he thinned out. His umbilical hernia went away. His face looked different. His hair was growing. He's got lots of energy. He's happy. He's bright. He's still at 4 is in diapers because he still had some developmental delay. And that was the thing that literally made me well up and want to cry talking to his parents, is because they said to me, will he ever catch up? Will he ever be normal? And I had to tell them I didn't know, because hypothyroidism in early childhood can cause irreversible neurologic damage. It's the #1 preventable cause of mental retardation worldwide. And that's why it's screened for when children are born, the newborn screen, when they get their little heel prick. His started when he was probably around 12 to 18 months, when he stopped growing. And that's why it didn't get picked up until, sadly, his pediatrician finally referred him to a specialist, the wrong specialist. But nonetheless, I'm happy to tell you that now this little guy, and I wish I would have taken a picture, is now in college here in Indiana at Ball State. He caught up. He's doing great. He is, I think, about 6'1" when he left me. He was tall, happy, and I was, as usual, his mom cried when we said goodbye at clinic when they brought him for his last visit, because they came with him even though he was graduating from high school. He did not cry, but he still gave me a big hug. So that's one of my happy success stories, and how you can change the life of a patient. So there's my little medical interlude about patient care. And then I'm going to tell you what else I love about my job. I already told you match day, so here's graduation. I love working with students. So as the Associate Dean for Student Affairs, I work with a lot of students, advising them. This is one of my mentees who was a medical student. He's now a pediatric oncology fellow at Riley. Here are 2 patients of mine. I have their pictures up because they were in a Riley hospital, which is our pediatric hospital where I work, newsletter, so that's why I can show you. He has type 1 diabetes, and his mom is a respiratory therapist in our NICU, and he's a doll. And she was born very premature and has thyroid disease and is super healthy, and I take care of her as well. These are my students who did that FCP1, Foundations of Clinical Practice, in year 1, where they are paired up with a physician. These guys came to clinic with me every month for the whole year, which was super fun. And now they're 4th years graduating. This is a former Miami student, Julia, who is now on the board of the Mallory Wilson. She's a 4th year. She actually did her summer preceptor shadowing with me a few years ago through the Mallory Wilson program. That's how I first met her. And now she's a 4th year student, and she and I are good friends. This is me at a research conference. So I still love research. I love the intellectual challenge of it. This was, you could see the posters. This was at a poster presentation. And they took this picture because they did a little story in the conference magazine about the research I was presenting. So I put that in there to show you research is super fun. And this last one is going to take us into our next section. And this is students of mine were at this place called Cake Bake in Indianapolis, which I don't know if anyone's been there. It's amazing. After we finished our mind body medicine elective, which is a semester-long elective that I teach, which I'm going to tell you about, which teaches mindfulness skills that I've just really gotten into the past years, and myself and some colleagues have been trained to be facilitators through Georgetown's program. And actually this wonderful young woman here, Kayla Brown, is also a proud Miami grad. She played on the basketball team at Miami, actually, and she is now a third-year student here. I only remember
I know
that.
her. She was a microbiology major. I was her advisor.
Oh, she's
Yeah.
doing great.
Excellent. Excellent.
When I put that picture, I'm like, oh yeah, and I forgot Kayla went to Miami too. Anyway. All right, so then this last section that we're going to move into and talk about for the next few minutes is what someone brought up, I think, about this whole idea of medicine is hard, and sadly burnout rates are high. So you don't want to get yourself into this situation, okay, where you look worse than your patients. So how do we prevent that? And let's talk about what the definition of burnout is. Okay, so burnout is defined as three things: emotional exhaustion, which is where you kind of, lose your enthusiasm for your work. You're just drained. Depersonalization. Okay, so you're cynical, you lose your empathy, okay, and you're just kind of like a robot doing your job. And then the last thing is this low sense of personal accomplishment. You just feel like nothing gives you, it feels like a reward and nothing feels good. And you can kind of think about this as, you have an energy account and you just keep withdrawing without depositing anything back in, okay? You need to deposit back into your energy account through rest, rebalancing your life. But burnout happens when the negative balance gets too high over time, okay? There are a lot of things that contribute to burnout, and which I'll talk about in a minute, but burnout is bad, and it's been studied quite a bit, and it's bad for a number of reasons. One, it increases medical errors, right? If you are feeling exhausted, cynical, like you are worthless and what you do doesn't matter, you don't pay attention and you make medical errors. You don't have empathy for your patients, okay, which is terrible, and they can tell that. And in fact, that leads to number 3, which is reduced patient satisfaction and adherence, meaning they don't follow your medical recommendations. It's been well shown that patients that think that their doctor does not like them don't follow their recommendations. Whereas if patients think that their doctor likes them, they're much more likely to follow their medical recommendations, which seems really, to me, seems really sad. But it also makes you think like, wow, how you treat people and the impression that they get about whether you really care about them really matters. Okay, it matters as a human being, but it also matters whether they follow your medical recommendations. And then kind of the internal stuff, people leave their work jobs, they retire early, they change practices. If they're unhappy at one practice, they are going to leave. Unfortunately, it can lead to substance abuse, drugs and alcohol, marriages, relationships break up, and then, depression and suicide. So those are all really terrible things that burnout can cause. So then the question is, why does this happen? Well, first of all, the practice of medicine is hard. Even I was telling you about my grandfathers, even before all these external, kind of challenges, it's still hard. It's a lot of, time and stress and important decision making that you make for your patients that if you're not careful can really take a toll over time. And somewhere between 40 and 50% of all physicians now report being burned out. So this is a real problem. Definitely inefficient work environments and inadequate support, kind of what we were talking about before. Loss of autonomy, flexibility, control. If you feel like you don't have control of your life at work, that absolutely takes a toll on people. Time pressures build into that. And then internally, if you aren't careful and aren't able to balance or find a good mix of your home work life and your personal life, that definitely takes a toll. And then finally, this lack of meaning in your work. And you think, how could you not find meaning in your work as a physician? Well, it can happen if your values are not aligned with the values of where you work. And you are having to, maintain productivity at the expense of spending time with your patients. And that can, you lose the meaning in work as one example. So how might we prevent that? Well, very quickly, the systems, we know the systems that physicians work in contribute much more to burnout than personal factors, okay? It shouldn't be blame the victim. Okay, let's not blame the victims, the physicians, that if you guys were just tougher and worked harder and could find a better balance in your life, you wouldn't get burned out, okay? It's instead, we know a huge proportion of this is systems problems that we need to fix. And so this is kind of what I mentioned before. Here are some things for you guys to think about now as you start to think about heading into a medical career. Work on your leadership skills, okay? Physicians, sadly, in the past have not been part of the solution. They don't always step up to, lead a committee at the hospital or become a hospital administrator so that the physician voice is heard at the table. So work on your leadership skills so you feel comfortable moving into those roles. We need you, okay? If you like technology, my goodness, please keep developing those skills so that you can fix our EMR or, work on quality improvement, okay, so we can increase our efficiency. So if these are of interest to you, absolutely, as you apply to medical school, oh my goodness, that would be an amazing thing for you to talk about in your interviews or on your application. Or as a medical student, if you have interest, a great thing to, pursue, again, is going into residency. So these are things where we have to fix the system that we work in, and again, you guys can be a part of it. So the last few things I want to talk about is, but you can also help by improving your own resilience, okay, and your own happiness by taking some responsibility for that. So we're going to talk about that just for the last few minutes. And what time are we supposed to be done, Dr. Carlin? Because I don't want to run over. You're muted. What?
Sorry, I clicked it, but it didn't click. 5:20 is.
Okay. All right. So doctors love their jobs on the whole, but they aren't happy with their work-life satisfaction. Okay, this is our career satisfaction is higher than the national average for full-time working folks, but lower in terms of our work-life satisfaction. I hate that term work-life because my life includes many things, which also includes life. So I think about it as work-life versus personal life. Oh my goodness, I haven't moved in my office and my lights went out. Okay, that's hilarious. We are energy savers here at IU. All right, so I am going to tell you a little story as I go turn my lights on. Oh, there we go. About a seminal moment that I had that made me realize I never wanted to be like this. Okay, so I took what is now called a gap year between college and med school. I thought I wanted to be a veterinarian when I went to Miami. I switched and decided to go to med school at the last minute. So I didn't go straight to med school. I went home and lived in my parents' basement, true fact, and had a few different jobs, including volunteering at the St. Jude Midwest affiliate in Peoria, Illinois, which is where I'm from, which is a children's cancer research center. I was flying, I'm talking fast because I don't want to run over. I was flying down to Atlanta to interview at Emory Medical School and happened to just sit on the airplane by one of the pediatric oncologists who I had met briefly who worked at St. Jude in Peoria. And so she and I started talking. And turns out she said she had 3 kids. And I said, oh, how old are your kids? And she said, okay, so so Jimmy is in 7th grade, or is he in 8th grade this year? And Susie, okay, I think she's in 4th grade. Yeah, she's in 4th grade. And then her 3rd kid, she was not sure what grade her kids were in. She had 3 kids. Now, she had a stay-at-home husband. And I do think to myself, would I be that critical if it was a man, okay, saying this, that he didn't remember what grade his 3 children were in? Would I feel as distraught by this? And I thought to myself, yes, because my own father, who was an attorney, knew very much about myself and my 2 siblings. But it made me realize I never want to be like that. I never want to have my career or whatever be so important to me that I could not sit on an airplane and know exactly what grade my 3 kids were in. And so that actually was a centering moment for me in terms of realizing I had to keep the most important things. And that was my commitment to my family. And I'm going to get back to what that commitment looks like. It looks different for everyone. But I never wanted to be like this little cartoon, oh my God, I forgot I had children. And so that really helped me in terms of when I was thinking about important decisions in my life. And so you guys will have these moments, and it might not be about your family. It might be about something that is important to you in terms of your career or patient care, but listen to your inner voice on those things and let your, heart and mind drive your decision making. And so this is my family. I have 2 kids, and I already told you my husband does emergency medicine, and my kids are in college now. Sadly, neither one chose Miami. I thought my daughter might, but anyway. And I adore them and still love spending, tons of time with them, and they are the most important thing to me. So we've asked this question of students and faculty. I'm going to quickly go through this, and this is just what's kind of interesting. How do you define wellness? And so this is what students and faculty say: physical and mental health. That if I'm feeling physically healthy, mentally healthy, emotionally healthy, then that's wellness to me. So how do you keep your wellness and your balance? So we follow a model of the 8 dimensions of wellness, which probably many of you are familiar with, that it's not just about physical health, it's about your intellectual health, which you already talked about. Someone mentioned, which is a great thing about medicine, I'm always intellectually stimulated, but sometimes you get into the drone of things, you don't, you have to remember that. Your emotional health, physical, social, so it's all of these things that you need to think about to remaining well, okay? So just exercising alone might not be the answer, okay? And we'll talk about that in a little bit. The interesting thing, and this is what I want to point out very quickly, is that students and faculty mentioned all of this when we did this big survey. I was involved in this wellness initiative for our whole school. But interesting, the faculty talk more about balance than the students do, which is interesting but not surprising, because you end up accumulating more things on your plate as you go along in life. So thinking about this idea of balancing personal life and work life becomes more important the further you go along in your career. But like I told you, this whole idea of a balance I don't like, because it implies that one is a winner, one is a loser, one is up, one is down, versus trying to integrate it all together. And I also think that my work is part of who I am. Okay, I cannot separate out my work life and personal life are both complementary to who I am. They're not at opposition. And this idea of this superwoman, and I'm speaking to the women in the audience, because sadly, you don't see pictures like this of men, okay, that are expected to be able to do everything. And I'm sorry, this is changing with your generation, I should say, but this is still out there. Okay, this is crap. Don't buy into this, okay? You don't have to be the superwoman who does everything, okay, and does it all well. You can try to do everything, but at some point in time, you have to stop feeling guilty. And this is one of the other things, besides that moment on the airplane, that was a life changer for me. And that was, you know what? I'm doing this all to myself, feeling guilty about not having the perfect balance in my life. No one else is judging me. I'm judging myself way harder than anybody else. And so I just needed to stop feeling guilty and instead deciding what was important to me and just being happy about the things that I was doing and what were in control and out of control, and accepting that life has its ebbs and flows. Sometimes you're going to be busier at work or your school work, or as a medical student, you're going to be crazy busy studying, and you just have to tell your friends and family, I'm crazy busy studying right now, but in 2 weeks, I'll have a lot more time. We'll do things together then. And just accept that that's how life is. It ebbs and flows for how busy you are, as well as, kind of sometimes you don't always feel as happy and satisfied with either your work or your personal life, but, you have to find that balance. And sometimes just good enough is good enough, and that's okay. And here's my example. I saw this movie. Does anyone know this movie? It's called Bad Moms. Okay, it's kind of a dumb movie, but what I loved it because she had to go to this bake sale, and all these moms showed up with these fancy cupcakes, and she was kind of like, you know what, I'm done. Her husband left, single mom, working, 2 kids. Screw it. I'm just showing up with the store, made donuts, and everybody can just get over it. And she gave up the guilt, looks very smug. So I actually kind of like that movie for that, because it's like, you know what? I don't make the bake sale, but I make the money to buy something to take to the bake sale, and that's good enough sometimes. All right. So the last thing I'm going to talk about is how you don't stress about things outside of your control. And that's why I'm going to suggest that doing mindfulness. Who here is familiar with mindfulness and has ever looked into mindfulness? Okay, this can be a life changer, okay? I love this picture. Is your mind full? or are you mindful? Okay, so mindfulness is the awareness that emerges from paying attention in a particular way, on purpose, in the present moment, without judging, and just letting life unfold in front of you moment to moment. And it can be incredibly life-changing if you are able to do this every day for at least a couple minutes, whether it's through meditation or just noticing things in your surroundings. And without a doubt, it's been shown to be very helpful. This is an article from over 10 years ago about using mindfulness for physicians to increase their empathy, increase, being trained, increase your mindfulness, and decreases burnout. So I'm not going to stand here and tell you guys that this is true for everyone, but I just want you to have open minds and start thinking about how you can take care of yourself now and develop some skills. I'm going to skip this one because so that you can, instead of just taking all these stresses and let them accumulate so that you lose your resiliency, okay, over time, that you can't get back down to your baseline, which does happen with repeated stressors. Okay, your stress response, if you're constantly in fight or flight, you're making tons of cortisol, tons of epinephrine and norepinephrine. Okay, that's exceptionally unhealthy for your body and your brain. Okay, it impairs your memory, your mood, your physical health. Okay, and chronic stress is very different than acute stress. Okay, again, chronic stress makes it very, very difficult for your body to return to baseline and to normal hormonal status and equilibrium. Okay, so there are physiologic and physical mental benefits to mindfulness, to getting back down to baseline and decreasing your stress. There have been tons of studies about this that shows that it decreases your blood pressure, heart rate, cortisol, sympathetic nervous system. It's been used for pain management in patients, depression, anxiety. Okay, you ruminate less. Who doesn't always start, you get thinking about something you can't stop, Okay, so there's so many benefits to mindfulness training. But again, or whatever you can do to release your stress and decrease your cortisol and epinephrine levels, it's worth it. Okay, so here are some apps maybe you're familiar with. Okay, some are free. Insight Timer is free. Headspace, you get like a 30-day trial. Calm, I don't know if that's free, but people love that. I don't have any business interest in any of this, but I'm just giving you guys some tips, again, to start now. And mindfulness might not be your thing, which is fine, but these are, having time where you just relax and you do things for fun, which I don't need to tell college students that, but don't stop doing these things. Okay, the further you go on, the busier you get. Don't stop doing these things that keep you happy and healthy, and connecting time with friends and family, which during COVID is even harder. So I'm not going to talk to you about a growth mindset because we don't have time, but I would encourage you as well to think about how you can develop a growth mindset, and I'm happy to send those slides to Dr. Carlin. But I'm sorry I'm a couple minutes over, but I'm happy to stay and answer questions. So thanks for your attention. And good luck to all of you guys, and keep having fun. College is the best 4 years of your life.
All right, well, thank you very much. Usually students, they just stick around. They've got questions. So okay. If anybody has to rush off, that's fine. I mean, we all have busy lives, but if you have some questions for Dr. Walvord, now would be the time. So we've got a whole bunch of thank yous coming in here.
So welcome. I'll put it back on this microphone.
All right. So I'll just get something started. I was at the NAP conference a couple of years ago, National Association for Advisors in the Health Professions. I was just getting in as the director here at the Mallory Wilson Center, and I said, okay, I want to find out what am I getting into, So I went to this meeting, and there was a physician at one of our lunch sessions. He was the one at Georgetown who was starting the whole doing the whole mindfulness thing.
Haramati?
Yeah. Took us through a mindfulness exercise. Put yourself in the kitchen. There's the cutting board. There's a lemon. Cut the lemon.
Yeah. Mindful eating.
Yeah. And so And just in imagining all these things and going through the suggestions about what we're seeing in our minds, and then it says, okay, and then it wrapped it up and said, okay, so how do you feel? You know, at the end, and it's like everybody was going, oh, you know, and so you know, so I went. I saw that and I said, this is great. This is actually, it works. You know, and I was a bit of a doubter before that, so.
Yeah,
So,
well, I appreciate you hearing that. And so the interesting thing about Adi is that he is a PhD. He's a renal physiologist. He's a hardcore basic science research faculty at Georgetown. He had nothing to do with mindfulness or wellness or anything like that. And I don't remember exactly how he got interested in it, but he became a convert. And that's how I actually got interested in taking and being trained at that, because I heard him speak at the AAMC, the Association of American Medical Colleges meeting, and was just inspired by him.
yeah,
And
yeah.
thought, my goodness, if this like crusty old, you know, hardcore physiologist, you know, can buy into this stuff and says it's life-changing, then wow, I can probably get some other people to do it. And so I did the training. It's a 4-day training, and the students absolutely love it. We've got a lot more facilitators trained.
Yeah, I keep thinking something like this would be good at the level of pre-meds too.
For sure. Because in fact, University of Cincinnati Medical School has been doing it for a while. And we had a resident 2 years ago, a pediatric resident who went to Cincinnati for medical school, and she took the mind-body medicine elective there. This is when we were just starting it here. And she said, oh, I still use all those skills as a resident now. She's like, that was, you know, I learned so much that I still use. And I'm so glad I took that course as a medical student. So you're right. I bet as a pre-med, then you could take it into medical school with you.
You would have that skill already that you developed. And it's not like we don't have stress at the undergraduate level. How many people here have no stress in their lives? Okay, I don't see any hands.
Yeah, because they're all super high achieving,
Yeah.
highly motivated students for
Yeah.
sure. That's
Yeah.
why I said students are hard on themselves already.
Yeah. All right, guys, questions? What do we have here?
And it can be about anything. You can ask me about medicine.
Doesn't have to be about mindfulness, yeah.
No, not at all.
Grace is thinking. Grace actually had a question earlier on, which we didn't get to. I saw it after the fact. You were talking about your first patient slide, the 4-year-old, 2-year-old, and actually asking about routine checking for that. And her question was, isn't that routinely checked? How is that?
Yeah, no, thyroid, it's not part of routine screening to do thyroid levels, but for anyone who's not growing, children, that's actually the #1 sign, is that they have very poor growth, because kids are amazingly tough. That's why I love taking care of kids. And it's not like adults. If adults were profoundly hypothyroid, oh my God, we wouldn't be able to get out of bed, literally. Whereas kids are tough, they just keep going. They might have symptoms, they just keep going. But he had terrible growth. So, I mean, he like literally flatlined in his growth. I didn't show you his growth curve. He was this far below the growth curve. So that should have been checked as soon as his growth slowed down. But there are lots of symptoms that make you think of hypothyroidism or low thyroid. So constipation, fatigue, hair loss, dry skin, cold intolerance, you know, all those kind of things. So I actually think his pediatrician actually missed the boat on this, honestly. But it's not routine. It's a routine part of the newborn screen, because babies can have congenital hypothyroidism, meaning they're born without a thyroid gland and then they never make thyroid hormone. And that's why it's screened for in the newborn screen, because again, they don't have very many symptoms, but their brain doesn't develop normally. So we want to catch that and treat it. Our goal is to treat it within the first 10 days of life.
Yeah. But he wasn't without a thyroid. It was just not functioning well.
Yeah, he actually was the youngest child I've ever taken care of who has autoimmune thyroid disease, or Hashimoto thyroiditis.
Okay. Yeah.
So he had very, very high antibodies against his thyroid gland when I measured them.
Yeah.
But it's exceptionally uncommon in that age. And his, like I said, probably started around 18 to 24 months. So like I said, I'm happy to answer endocrine questions too.
Okay.
Who do you suggest?
Okay, I have questions here. All right.
So Marina.
Okay, and And this question from one of our attendees. She says, if I actually have a strong interest in pediatric/reproductive endocrinology, what do you suggest I do now as a freshman?
So I would say you can just take, do your usual stuff. I mean, you have to go to medical school and do all the same things in medical school to get into a residence in pediatrics, or OB if you like reproductive endocrinology, because actually the gynecologists do reproductive endocrinology. But there are things you could do. You could look for someone who's doing some sort of research in that area that you could, do a research project with. Or if you are interested in doing pediatric research, there are some pediatric hospitals that have opportunities for undergraduate students. There also are a lot of diabetes camps around the country that need students to work at them and volunteer at them over the summer, which is actually a great opportunity for students. I actually, on my long list of to-dos, is to write a medical school recommendation letter for an undergrad who worked at one of our diabetes camps for a couple summers that I got to know. So those are kind of fun things that you can do. But I would say you don't have to do anything special. That's something that you decide way, way, way down the road. You're like 10 steps ahead. But I would say maybe doing research or even shadowing. We can't have shadowing right now because of COVID. But once that things get better, I would say you could always see if you could shadow someone.
Yeah. It will get better.
Yes. Did I say if? I meant to say once things get better.
If and when. Let's say when it gets better. Yeah. Or when we fully adapt to it and figure out how to do some of these things.
Yeah, so I can see the chat too. I opened the chat. So Garrett's question about if any physicians use meditation or mindfulness, absolutely. So there have been a ton of really cool studies, especially like in the pain management literature, that anesthesiologists use mindfulness techniques for patients pre-op for relaxation. They use them for pain control. People use them for hypertension. People use them for migraines. I mean, there are a lot of physicians. There are some physicians that are more comfortable using kind of alternative medical strategies, but I think more and more people are open to that. And that's one of the things we tell our students who take our elective in mind-body medicine, is that these are techniques you can teach your patients. And so, yeah, there's really more and more really good literature, again, measuring not just like pain scores, but also, cortisol levels, a lot of sympathetic tone, things like that.
Okay,
Why
you
did
have
I
more
want to
questions.
be a pediatric endocrinologist? So I went to medical school thinking I would do pediatrics. I love kids and I love my volunteer experience, but I didn't decide to until my 4th year of medical school, when I just did an elective that I really loved, surprisingly, that I thought I might do pediatric endocrinology. But then during residency, I went back to, well, maybe I'll do general pediatrics. But I just loved endocrinology. I loved the thought process. I loved the patient types. I knew I wanted to stay in academic medicine, and it's a little bit easier as a subspecialist. And I love research. I love taking care of complicated patients. But there was just something about the endocrine system that fascinated me, and I loved being able to treat patients and make them better. So diabetes is a tough one. I call diabetes the art of medicine, trying to help kids who have diabetes take care of their diabetes and stay healthy. But otherwise, I love, making the diagnosis and treating patients with hormones and seeing them get better. Whereas, like, nothing against gastroenterology, but peds GI, I could never do that, like chronic abdominal pain. Like, I would find that very frustrating not to know what to do. So, I like the other next one from Andrew about what advice would I give myself on my journey. I would say just keep enjoying college. Take classes that interest you. Don't take a bunch of biology and science stuff. You have plenty of time for that in medical school. Take history, take literature, take theater, that's one of the many wonderful things about Miami, is that you can have the opportunity to take all those other classes and make yourself a well-rounded person. So I don't know, I enjoyed my 4 years at Miami a lot. I had a lot of fun. I took a lot of really interesting classes. So, but you do have to prepare yourself for med school. It's a different time. But I think I would just say enjoy it. Try not to worry too much about getting into medical school all the time, if that's what you want to do.
All right. Any more questions? Well, we've got Dr. Walford here.
Okay, now I guess I think the last thing is I would keep an open mind too. In terms of, so there's a lot of students that come to medical school thinking they know what they want to do. And sometimes it works out and sometimes it doesn't. You know, if there's certain things that are crazy competitive that you might not end up working out for you. And there's so many other things you might love doing. But then also, you know, I told you I went to med school thinking I wanted to be a pediatrician. I did my general surgery rotation, and I absolutely loved it. I loved it. You know, so I was so surprised at how much I absolutely love being in the operating room and digging around in people's bellies and sewing stuff up and cutting things off, and it was super fun. So just keep an open mind that you might, you know, find other things interesting. And that's how you learn the most too, is that every rotation, everything you do, just go in thinking, you know what, even if I decide I'm not going to be a psychiatrist, I'm never going to take care of psychiatric patients and learn about psychiatry again if I don't go into psychiatry. So I'm going to make the most of this. I'm going to learn the most I can, because my neighbors are going to be asking me questions and I'm not going to know the answer if I don't pay attention. Because people don't ask me questions to say, Emily, you're a pediatric endocrinologist. What do you think about this rash? Okay, well, good thing I took a dermatology elective as a resident, so I can actually look at people's rashes and tell them stuff.
Yeah, you got measles. Yeah, get away from me.
Chicken pox, which no one gets anymore. I still know what chicken pox looks like.
Yeah. Well, I know what it looks like because I know what shingles looks like.
Oh, yeah.
Day after I turned 60.
Oh,
Oh, that's all right. I recognized it immediately. Got to the doctor, acyclovir, didn't progress. It was fine. But that's why I'm glad I teach microbiology. I can recognize these things too. Yeah. All right. Any other questions? Do you have an email? Yes. Okay.
I just put it in the chat.
Yep. Very good. All right. And if anybody forgets, you can reach me and I can share that now that she has shared that. So.
All right, guys. Well, good luck. Sorry I couldn't come in person. I appreciate the invitation, Dr. Carlin. I love coming to campus, and
We will have you back here as soon as we can. You know, as soon as everything permits. Now I know I have to stick around at the end here because I have a group of student presentation for next week, and so we're going to take the opportunity to talk a little bit about what their presentation is once we're wrapped up here. So,
okay.
All right.
All right.
So thanks again. We'll be talking again in the near future. But we got a board meeting coming up, right?
Probably.
Yeah. Okay.
I'm sure it's all Zoom, so that's
It's all Zoom. Yes, it's
not
absolutely
about
Zoom.
quite as much since I don't have to travel, but yeah.
Right. Okay. All right. So we'll talk to you then. All right.
Okay. All right. Bye.
Bye-bye.